Hi guys, welcome back to my YouTube channel. And I wasn't really sure if I am going to make this video, but because I have so much to tell you guys, I have so much to share, I thought maybe I should come and make this video for you all. And firstly, I'm extremely sorry if you're able to hear some background noise, because that's my mom talking to Sian, because Sian is getting a little cranky. And I wanted to come here and make this video, so please bear with me on that. So let's talk postpartum. I'm not really sure of where to start, because postpartum, oh my god, I have so much to share with you guys. I'm not sure where to start. It is so intense. Postpartum is so intense, and I'm shocked. Like, nobody ever told me this before getting pregnant. I thought it's just the labor pain, and once I'm out of labor, the baby is with me, that's it, it's going to be bliss. No. Then comes postpartum. मुझे किसी ने पहले बताया क्यों नहीं कि postpartum करके भी कुछ होता है. And postpartum is not just a word, it's intense. Okay, it is really intense. It really is a roller coaster of emotions. Like, everything is new. You are a new mom, you have a newborn baby with you. Like, you have never really cared for a newborn tiny baby, and boom, there comes a baby and you have to look after it. The baby is your responsibility. You are a new mom, there's a new baby, new routine, new schedule, everything is so new. Your life seems to have changed 360 degrees. It is a roller coaster, you guys, and I want to talk about it. So firstly, let me just share मैंने postpartum में कैसे क्या किया. Like, a lot of you guys wanted to know if I had a japa. No, there was no japa. I wanted to do things my way. I wanted to do things myself, and I took help from my husband and my mom, my mummy, my own mummy, to help me. I called her home for I think the initial 2 weeks to look after me. Not the baby, because I needed help. I had stitches down there. It was tough to get up, it was tough to walk, it was tough to feed the baby. So I needed help, and my mummy was there. I'm so grateful that she could come. She stays just nearby. I mean, मैं अभी उन्हीं के घर पे हूँ. मैं अपने मायके आई हूँ, which is why I have the time to film these videos. So I'm so grateful to my mom and my husband that they were so helpful. I actually needed help. I needed help myself, which is why I called my mom for night sleeps to help me get up and feed the baby and all of that, which she did. Okay, now I have so many things to share with you guys, and I have written down everything because I do not want to miss out. And I have divided it into the good and the bad, like the good parts of my postpartum and the bad parts of my postpartum journey. Then I'm going to give just a general advice to others, like not you, not the new mom, for others, like what they should be doing and what they should not be doing, and general talk and general advices to new moms based on my personal experience. Now, without much ado, let's get started, because this might be a long video. I'm going to first talk about all the good parts. Okay, now the first thing is, you have a newborn baby, and once you bond with the baby, nothing like it. It is the most beautiful feeling you would ever feel as a new mom. ये feeling पहले कभी आई नहीं होगी, but once you have that baby with you, it just comes. I mean, I know this is not the case with everyone, because a lot of women go through postpartum depression as well, and they don't get that feeling soon, but sooner or later वो चीज़ होता ही है. I'm pretty sure about that. So that is the good part. And the bonding with your baby is the main thing that will help you live through the stress that you've just been through, both physical and mental. It is going to help. So looking after my baby really helped me heal faster. It created a bond between me and the baby and gave me so much happiness कि वो दुख, दर्द, everything just was flushed down the drain. Now ऐसा बोलते हैं, लाइक मुझे बहुत लोगों ने बोला आफ्टर आई वॉज बैक होम फ्रॉम द हॉस्पिटल कि यू नीड नॉट डू द मालिश, यू नीड नॉट डू you need not bath the baby, you don't need to do all this, you can just rest and you can let others, or you can hire a nanny or japa someone to look after the baby. And my relatives actually offered to help the baby, but I wanted to do everything myself. If you're a new mom, I'm pretty sure you can relate. I was waiting for this. I wanted to look after my baby. I wanted to change my baby's diaper. I wanted to give it's him actually, a bath. I wanted to give my baby a malish. And it can really create such a beautiful bond between you and the baby, the new mom, touching and feeling the new baby. The baby starts responding to it sooner or later, and it is so beautiful. Which I really experienced. I wanted to experience this and I did. I know starting में थोड़ा tough हो सकता है, you might say that, because of the pain and because you just went through labor and or a C-section. Things can be difficult for the initial few weeks. बट आई डिड रेस्ट फॉर अ वीक बिकॉज मेरे बेबी का वैसे भी अम्बिलिकल कॉर्ड सूख के निकला नहीं था, तो वैसे भी उसको मालिश एंड बात नहीं कराना था, सिर्फ स्पंजिंग था, वो भी मैंने किया है. तो वंस द अम्बिलिकल कॉर्ड ड्राइड ऑफ, I started doing the malish and bathing the baby and everything, and it gave me immense happiness. Also, I got back to work in a week. Now I wanted to get back to work because I could not sit in pain. I could not be in that phase. I cannot explain how I felt not working. Like हॉस्पिटल से वापस आके लुक आफ्टर द बेबी फुल टाइम, द रूटीन वॉज कम्प्लीटली चेंज. जो प्रेगनेंसी के पहले वाला रूटीन था, प्रेगनेंसी में रूटीन था, एंड बेबी के बाद वाला रूटीन, आई कैन नॉट टेल यू, इट वॉज सो डिफरेंट एंड इट वॉज मेंटली ड्रेनिंग. That routine I did not like. I wanted to get back to work. I could not be a patient and sit. So, and obviously मैंने अपने comfort के हिसाब से ही काम किया, but I got back to work. I got back to filming and it made me so much better. मैं बहुत जल्दी heal हो गई. I mean, it did take almost a month for me to completely heal from the C-section. I had a C-section, by the way. I am going to post my labor and delivery story after this, ठीक है. So yeah, so bonding with the baby, being with the baby, side by side doing my work really helped me get back to life. I will call it life because postpartum, oh my god, is not easy. It is mentally draining and you sometimes start doubting yourself being in that phase. I had to get out of that phase. So that's a good part. Another good thing was I saw a whole new Chirag. I mean, I have seen Chirag, my husband, playing with his nephew, but I had never seen Chirag aise. I mean, I cannot explain you how different he has been ever since he has become a father. He is so caring, so loving towards me and towards Sian, and that also gave me so much happiness. I mean, once you see the love of your life being the father of your child, it's a whole different and new feeling, and that also gave me so much happiness. This is the good part because even that helped me heal faster. Another good thing is my breastfeeding journey was pretty much smooth. Abhi Sian is almost 7 months old and abhi tak I am breastfeeding him. We have just started solids and pura 6 months I have exclusively breastfed Sian. So that was the best part. Another good thing is I found a really good pediatrician after I took this second opinion. Pehla pediatrician was not good, that I'll talk about in the bad part. So ये वाला जो मेरा न्यू pediatrician था वो चिराग के nephew का भी है, and that's how we connected with him, and he was so motivating. Like he motivated me so much to keep breastfeeding and to never doubt myself, because doubt can create stress and stress can lower your milk supply. So that doctor motivated me to keep breastfeeding, and that is exactly what I did. A good doctor can really make a difference. Another good thing is I used to not like the way I looked, not like the new me, I was constantly smelling like milk, looking like a homeless person, and I was not happy with the way my tummy looked. I mean, obviously, your body changes, and Chirag was the one who always told me that I have given birth to a baby, and how can I not love myself? So Chirag has always tried to motivate me, and जब भी मैं sad हो जाती थी, he was always there to change my mood. Now the bad part. I had really intense mood swings. Like मेरा mood मेरे काबू में नहीं था. I would get so emotional. I would get sad. I would get angry. I would cry. I had multiple breakdowns in my postpartum, the initial 1-2 months. बाहर से I knew I looked happy to everyone on social media. Whenever my relatives used to come visit me, I used to look happy. But my mood was constantly up and down. Like, I cannot even tell you how tensed I was. The other minute I was crying, the other minute I was super sad. Then now, because I had a C-section, after 2 complete days of labor pain, due to unavoidable circumstances, I had a C-section. Detailed story will come up in the next video. I had stitches. Okay. Now, because I had stitches, my stitches used to pain a lot. I was on painkillers obviously, but they only used to last for a few hours, and I couldn't take painkillers बहुत सारे. So मुझे पेन होता था, स्टिचेस पेन होते थे, इट यूज टू इच एज वेल. आई ऑल्सो हैड एक्सट्रीम गैस पेन फॉर 1 whole month. So along with the C-section pain, my tummy, my abdominal muscles used to pain. Along with stitches pain, I also had tremendous gas pain and diaphragm spasms on the upper right side. And I was also on antibiotics, due to which I had severe loose motion for 3 to 4 days, and that also caused me extreme abdominal cramping and pain. Now comes the spicy part, and I'm pretty sure every single new mom, or not even a new mom, every single mom is going to relate with this and agree with me. You are going to get a lot of advices. Most of them are going to be stupid advices, baseless advices with no scientific evidence. And now, because I am from the science field, I know ki this is rubbish. Okay, now when elders try to tell you a certain thing, they try to tell you to do this, to do that, without any scientific evidence, you can get pissed off, especially if you already have mood swings. So yeah, ये बहुत सारे episodes हुए, and like obviously I was only following what the doctor said, and then I had to tell them I'm only going to do what the doctor tells. So yeah. Another thing is, now newborns rote hai. There's no like specific reason as to why they are crying. They just cry because they were in your warm cozy womb, and all of a sudden they're out in the open, not near the mom all the time, and their tummies are not always full like they were when they were in the womb. So babies cry. It's a change of environment for them. So when Sian used to cry, everyone at home used to make a big deal out of it. When Sian used to cry, I used to get scared, thinking now everyone is going to come inside and ask why he is crying, because ये बहुत बार हुआ. Out of concern, they used to ask, because they really cared कि ये क्यों रो रहा है. ठीक है, but it really took a toll on my mental health, and मेरा हार्ट बीट ऑलरेडी थोड़ा नॉर्मल से ऊपर था आफ्टर माई ऑपरेशन. एंड बिकॉज ऑफ ऑल दिस मैंने इतना स्ट्रेस ले लिया कि सियान क्यों रोता है, एंड बाकी लोग इतना और स्ट्रेस उस चीज़ पे और मुझे इतना स्ट्रेस दे रहे थे कि मैं हार्ट बीट वॉज ऑलमोस्ट 150-140 फॉर गुड 2 weeks. उसके नीचे आ ही नहीं रहा था मेरा हार्ट बीट. अगर ये कंटिन्यू होता तो मुझे शायद हार्ट स्पेशलिस्ट के पास जाना पड़ सकता था. सो आई वेंट टू माई गायनैक. मेरा ऑलरेडी अपॉइंटमेंट था विथ हर. सो So she checked my heartbeat and she told me, Surbi, you are taking a lot of stress. Just calm down. Don't think what others are thinking, what others are trying to tell you. Don't think about that. Just calm yourself down, because क्योंकि अगर मैं रिलैक्स नहीं हुई तो और बहुत बड़ी प्रॉब्लम्स हो सकती है. तो शी टोल्ड मी टू टेक वो मॉनिटर जिससे हार्ट बीट चेक करते हैं. तो मैं वो दिन में 3-4 बार चेक कर रही थी. तो वो ग्रेजुअली 2 वीक्स के बाद ठीक हुआ मेरा हार्ट बीट. एंड देन चिराग टोल्ड एवरीवन इन द फैमिली टू नॉट give me stress about why Sian is crying, because Sian is a baby. It's a newborn baby. It will cry. Let's just not make a big deal out of it, right? So if you are a mom-in-law, if you are a relative or a family member, and if there's a new mom and a new baby in your house, please take this advice from me. Do not stress them out. Another thing is, it's convenient if people come and visit you at the hospital, rather than later on coming at home and having a good time, because it's a new routine for the mom. The mom is not yet healed. The baby is so tiny, so vulnerable, can catch cold, cough, everything from whoever visits. So it's better to take this into consideration कि बस जाके उनको हॉस्पिटल में थोड़ा टाइम मिल के आ जाए. And if at all you want to go and see the baby at home, maybe wait for 2-3 months, or maybe ask them when they are ready to accept visitors. I think that would make sense. Now please take this as a general advice. I'm not targeting anyone. TK, I do have more general advices in the next part in the same video. Okay, another really bad thing is my first pediatrician was like, seriously, was he even a doctor? Like, I had such a bad experience with that doctor. Like, I went to him for the first appointment, ठीक है, for first appointment of the baby, and he just checked the baby's weight, everything was perfect. And then he told me कि you can start giving him formula. अभी के एज में, मतलब he was just 6 weeks. अभी के 6 weeks के तो बच्चे 90-100 ml भी पी लेते हैं, तो उसको फॉर्मूला देना स्टार्ट कर दो, without even knowing the fact that I am exclusively breastfeeding him. Like, why is there a need to give him formula? अगर if I am not making enough milk, then formula देने बोल रहा है डॉक्टर, तो मैं समझ सकती हूँ, right? But without even asking me if I am feeding him, if I am breastfeeding him, he just told me blatantly to give him top feed. And because my mom-in-law was with me, my husband was with me, they also thought कि top feed देना ज़रूरी है. And उसके बाद 3-4 weeks सबने मुझे इतना इरिटेट किया कि you have to give him top feed, because the doctor said but my heart knew कि there's no need to give my baby the top feed, because I am feeding him. The baby रोते हैं, it's ज़रूरी नहीं because the baby is not getting full, so the baby is crying. And I was in constant dilemma, was in constant fight with myself whether I am doing the right thing of not giving him the top feed, the formula milk. क्योंकि मैंने उसको नहीं दिया, मैंने उसको मुश्किल से 2 बार दिया होगा, वो भी घर वालों ने बहुत फोर्स करने के बाद. उसके बाद even after they telling me मैंने नहीं दिया, and I just wanted an assurance whether I have done the right thing or not. And then I met the good वाला doctor जो मैंने पहले बात की उसके बारे में, and he told me that the baby's weight is a little over, like few points over what the weight should be. He is so healthy and his weight is just perfect, and I have done the right thing of not giving him the top feed, and I should continue breastfeeding him exclusively. And that really made a difference. It just motivated me so much, and I got so happy, and it just changed the way I was looking at things. After I had Sian, I was doubting myself, and उसी दिन वो doubt पूरे ख़त्म हो गए, and I got so confident, and then there was no looking back. So having a good doctor can really make a difference. If you are not feeling right with your doctor, do take a second opinion. Another bad thing is people commenting on my weight, on how different I looked, how my nose is still bigger, and also commenting on the appearance of my baby. Okay, the baby's nose looks like you, but overall the baby is like his dad, and so on. I think whenever you come and visit a new mom, you should not be commenting on the way the mom looks. Maybe you can just come and ask, how do you feel? Okay, like you do not really need to comment on the way the new mom is looking, because she knows how she is looking and she has already been through a lot. So can we just keep the appearance aside? And I'm also talking about my friends who came to visit me. The first thing they commented was on my weight, and I told them it's okay because I just had a baby. Maybe I'll try losing my weight after I stop breastfeeding. So yeah, I mean, and also it's okay. I mean, I am happy that Sian looks more like his father, because what better than creating a look-alike of the love of your life? I mean, now you have two people to love. But comments don't really come that way. Like, you can, like, people just come and say things like, oh, the baby looks like his father because he is fair, but the nose is like yours, so why don't you do some what do they do, malish or something to keep it pointed? And then I came to a point wherein I had to back answer, and I had to say ki baby is looking like his dad, that's really good, but let one thing be like me, right? Next really bad thing, and maybe it is just me, I love the concept of gifting. Okay, if you are my friend or if you know me personally, you know how much I love gifting people and receiving gifts. I love the concept of gifting, like buying something for the people you admire, the people you love, is so lovely. But I do not like recycling gifts. Like, just because you have received it from someone and you don't want to use it for your baby, you will just pass it on. So that thing I do not like, and I do have a lot of such stuff with me, and they are just lying up in the cupboard, and I'm not going to use it because they did not get it specifically for my baby. Maybe I am like this, maybe you are okay with it. Okay, now I am done with the good part and the bad part in my postpartum. Okay, now let's just start with the general talk and the general advice that I want to give others and not the new mom. And also I'll talk about things that I want to tell the new moms. Now, my advice to others. Obviously, the first thing has to be, do not comment on the new mom's appearance or the baby's appearance, or whether the baby is looking very slim, the baby is fat, the baby is healthy, this, that. Maybe just meet them and go. I'm sorry if you're able to hear that, because Sian is laughing a lot and बाहर पता नहीं क्या मस्ती चल रही है. Another really important tip and advice I'd like to give is, help the mom, not the baby. Now सबको लगता है कि न्यू मॉम को हेल्प करना मतलब उसके बेबी को ले लो, उसका सब चीज़ तुम ही कर लो, मालिश, नहाना, डायपर चेंज करना, ये वो, एंड जस्ट लेट द मॉम रेस्ट. No, how about you help the mom and let her help her own baby? I mean, that is how it is supposed to be. I wanted to look after my baby, and I wanted help for myself, not for the baby. Okay, so I'm pretty sure you can relate if you are a new mom as well. And if you are a relative or a mom-in-law or a mom or a friend or anyone, if you want to offer help to the mom and not to the baby. Do not talk about low milk supply, and don't tell the new mom that the baby is crying because the baby is not getting enough milk or the baby is hungry. No. Another advice I would like to give is, visit hospital instead of visiting the new mom's house, or maybe visit the new mom's house after 2 months, if that sounds right. Another advice, after the mom has already given birth to the baby, stop asking what her preference was, whether she wanted a boy, whether she wanted a girl. If she has a girl, oh, do you really wanted a girl? Or if she's had a boy, oh, you wanted a girl, right? Stop asking if she had a C-section or a normal delivery, vaginal delivery, whatever. Wait for her to maybe talk about it. She'll talk about it when she's comfortable, if at all she even wants to talk about it, right? Keep your advices of all the age old techniques, age old advices to yourself, like shaping nose with the massaging technique जो भी ऐसे करते हैं, giving baby honey, गुट्टी, धूरी, all of that, animal milk to the baby. No, I'm so glad all of this was written in the baby's report when I returned from the hospital. Like the doctor actually mentioned this in the report, not to do any of this, and that was very helpful. And whenever you go visit a new mom, make sure you sanitize your hands. Do not touch the baby if mom is not okay with it. Maybe you can just ask if they can take the baby. If she says no, then please respect boundaries. Do not kiss the baby. This is a strict no. And if you're sick, better just stay at home. Now let's talk about general advices for new moms. All I would say is trust your body, trust the process. Stress can really lower your milk supply, and ये होता है. So better just trust your body, go with the flow, trust and believe that you are making enough for your baby. Crying baby is not equal to hungry baby. Always remember. You are doing a great job, mama, and if others are commenting on your low milk supply apart from a doctor, just ignore. And do not listen to others' journey. Now you might have a few friends, a few relatives who have had a bad experience with their breastfeeding journey, with their baby, with their labor, with whatever their birth experience. It is not the same for everyone, so do not get demotivated. If they've had a bad experience, does not mean you are going to have a bad experience as well. C-section or normal, you are strong and you are brave no matter what. I will talk about this in detail in my labor and delivery story because I have been through this personally. Breastfed baby or formula fed baby is the best, no matter however you are feeding the baby. I know a lot of you moms can get a little demotivated if you're not genuinely making enough milk and if you have to give top feed to the baby. It is so normal. Your baby is getting the nutrition he or she needs, so do not worry, mama. And another final advice is, people are going to comment on your appearance, on your baby's appearance, especially if they are meeting you after a very long time and you are going to look different no matter what. ऐसे लोग होते हैं जो बच्चों के रंग के बारे में, बच्चों के अपीयरेंस के बारे में, तुम्हारे अपीयरेंस के बारे में कमेंट करेंगे ही करेंगे. एक ना एक ऐसा बंदा या बंदी ज़रूर तुम्हें मिलेंगे, तो बेटर जस्ट इग्नोर इट. एक कान से सुन के दूसरे कान से निकाल दो, because I have been through this. I think my postpartum video was all about ranting and complaining, but that's how it is, that's how it was. I just wanted to be true to you all, because I know postpartum is not easy. So if you have been through this, know that it's normal, because I have just shared things that I have been through. Please know that I am not targeting anyone, and I am not talking about anyone specifically. This is just my general experience that I wanted to give you all as a general advice. ठीक है, do let me know in the comments what all you have faced in your postpartum journey. I think that's it for today's video. I'll be back soon with my labor and delivery story. See you guys. Bye.